Hi, my name is JoAnna, and I'm the Admissions and Marketing Director for the Lantern of Saybrook. Welcome back to JoAnna's Community Corner. We want to thank Troop 52 from Saybrook for joining us last week. But today we have Dr. Tom DiSalvatore from DiSalvatore Chiropractic. So welcome, Tom.
Thank you very much.
Glad to be here. Well, we're so glad to have you. The history of chiropractic, when I was doing my research, I didn't realize it started back in the late 1800s.
It did.
Yeah. So the philosophy that you have with chiropractic is more towards, the holistic approach, treating the whole person, mind, body, spirit. So with that in mind, where do you start?
Sure. Well, chiropractic, the term chiropractic was actually created by D.D. Palmer back in the 1890s. But manipulation itself has actually been around since the days of the Egyptians. So we're talking 5,000 years they've been actually adjusting people.
Wow.
We just actually coined the term chiropractic, which means is Greek, done by hand. So when chiropractic first came out, it was more poo-pooed by most people,
Right.
Or by a lot of the professions, especially the medical profession. In fact, chiropractors were thrown in jail. They were for practicing medicine without a license. But now all 50 states have their own licensing boards, and we do our own thing, just like the rest of medicine.
Yeah, and it's wonderful because now more than ever, it's your insurance pays for it.
Yes, most insurances cover chiropractic to some degree.
And we're including Medicare, Medicaid.
Yes.
Yeah, so
Yes.
that's wonderful. And then when I was doing it, a lot of times people go for the quick fix.
Yes.
They go for the pain relievers.
Yes.
And things like that. And when I was doing my research, I found out that one in three of us knows someone who's addicted to opioids.
Yes. That's very true.
That drug overdoses have tripled since the 1990s. But you guys you really use.
Yeah.
What do you guys do for pain?
Sure. Our license doesn't allow us to prescribe. So in the state of Ohio, we cannot prescribe pain medicine. If we wanted to prescribe pain medicine, we'd go to medical school or osteopathic school to do that. We do everything through what we call the adjustment, through nutrition, through lifestyle changes, through exercise. All these things can help reduce a patient's pain. And we start with foundational things, kind of like taking a history on somebody, going through their past medical history, doing an exam, trying to figure out what's wrong with them. Once we find out what's wrong with them, we arrive at a diagnosis, then we can better prescribe the treatment. And sometimes the treatment will be manipulation. Sometimes it won't be manipulation. Sometimes it'll be nutrition, or it could be physiotherapy or physical therapy or just lifestyle changes, home exercises.
Mm-hmm. Now, when it comes to that, I want to talk about the SHAPE program because I did do the SHAPE program. I was very successful at the SHAPE program. But with a lot of things, and Americans were really good at this, is once we achieve the goal,
Yes.
then we stop living the lifestyle,
You're
which in
absolutely
turn, you fall back into your old patterns. So
Yes.
I want you to tell everybody about SHAPE because SHAPE does work,
Yes.
but SHAPE is a lifestyle change.
It is. SHAPE is definitely a lifestyle change. One of the things that the SHAPE program does is it recalibrates this little organ inside your head gland called the hypothalamus. It's unlike anything else that's out there, but it's not to say that if you continue to eat Twinkies and Pepsis or drink Pepsi for lunch every day, you're not going to get big again. Because like you said, it's a lifestyle change. So patients do come in and they want to become what I call deflamed. So when you have an inflammatory lifestyle, you eat a lot of sugar, you go out to eat to a lot of fast food joints, a lot of the fats that we're not supposed to have, you eat. And this is what makes us inflamed. So we get bigger and bigger and bigger. And our body starts storing a lot of our fat in our fat cells. So your brain actually starts to become accustomed to, you start eating a lot of junk food.
It actually makes you hungrier.
It makes you hungrier. And so it plays this trick on your brain. It makes you eat more of the same types of foods. They actually did a study where they saw that on a brain scan that sugar excites the same parts of the brain as cocaine does. So it's that addictive. So again, going back to what you originally said, it is a lifestyle. So if you fall back into that, you're just going to get big again. But the longer you create a healthy lifestyle, and it's through shape, and getting enough sleep and exercising and taking care of yourself, the longer you can do that, the less of a chance that that happens. However, life happens, and you do have people get sick, family problems, and you start to go back to your old habits. And that's part of that feeling good with the junk food and the sugar. And that's what you want, is you want to feel better when you're in pain. So.
Yes. And a lot of people like myself, because listen, we're all here. I'm telling you, I've been big, I've been small, I've been everywhere in between. A lot of us have that emotional eating. Yes. And that's not something you can fix. That's something that's an inward thing. Absolutely. That people have to fix themselves. So if somebody wanted to come, how do they start shape? How does it start?
Absolutely. When somebody comes in, they usually, we have to find out their why. Their why is a big thing in anything that you do. So we figure out what their why is and try to sort through that. For some people, they want to look good. Some people want to be healthier. Some people, they want to be around for their grandchildren. They want to live a long, healthy life. Depending on what their why is, we can definitely cater a program to them. Now, what's even more important is their past history, and that includes their past diet history. We find that a lot of people that go through, especially protein only or fat only type lifestyles, their metabolism is flawed. So we have to take that into consideration and cater to that. Now, there's some things that I'll recommend nutritionally to them, as opposed to if somebody was just a junk food junkie and came in, and did that. But your body will get used to whatever you throw at it, whether it be good or bad. It'll respond accordingly, and we have to know how to counter respond and get you back to shedding the fat out of your cells rather than taking up the fat into your cells, and that's a brain thing.
Yeah. So chiropractors don't treat the cause. Well, they treat the cause, not the symptoms.
That's right. We treat the individual, and we try to eliminate the cause of somebody's pain. Like, most people are in pain not because they have an ibuprofen deficiency or not because they have a muscle relaxer deficiency. It's because they have a problem. And those problems end up causing muscle spasm and inflammation. But if we can get rid of the problem, you can get rid of the symptoms.
Yes, because like I said, everybody would like that quick fix.
Absolutely.
Quick fix. Now tell me, how does inflammation work, and how do you work when it comes to arthritis for our seniors?
So 30 years ago, we probably wouldn't be having as detailed of a discussion about inflammation as we are now.
This is relatively new information.
This is relatively new information, probably within the last 25 or 30 years. But what we're finding is a lot of arthritis, any of the itises, arthritis, bursitis, tendonitis, could be caused from overuse, but it also could be caused from tissue that's not put together right, and that's usually because of our nutrition. Now, it's not necessarily our fault. Some of it is our fault. We make bad choices and whatnot, but some of it is actual food. Like if I took an apple today and I compared it to an apple of 30 years ago, there's no comparison. The apple of 30 years ago is far more nutritious than the apple today. So I have to eat more apples today than I used to 30 years ago. And that same apple, as much as it's considered an anti-inflammatory food, it's not as much as it was 30 years ago.
And why is that, though? I don't want to interrupt. But...
Sure. We're growing our vegetables on demineralized soil. We're pounding out a lot of volume of fruits and vegetables, and the only way to do that is through a lot of pesticides and herbicides and getting rid of a lot of the bugs that are good for growing, and a lot of that nutrition just is not in the soil, so it's not in the fruit or it's not in the vegetable.
And does that hold true as far as our meats go also?
Actually, with meats, it's a little bit different. Commercially grown beef and chicken, they pump them full of growth hormone to get them as big as they can in a short period of time. Antibiotics, okay, that's all passed through to us. And a lot of pesticides and herbicides when they're eating food that's not good for them, it gives poor quality meat.
Okay. So can you fix that by just eating more organic?
You should eat more organic, especially now more than ever, and then watch what you're eating. They do use a lot of glyphosate, which is a spray in the United States to help weeds. In other countries, they don't. I have patients that they cannot eat pasta that in the United States. However, if they went to Italy, they could eat it all day there and not have a problem. Because in Italy they don't use, and we don't know what causes it for sure, but we know that they don't use hybridized wheat and they don't use glyphosate. Now, it could be a combination of that when they grow it, or or it could be one or the other. We really don't know what the issue is. But there's a lot of people that go overseas and they don't have a problem with gluten or wheat or anything like that.
So it's really to keep up with the demand that the U.S. wants.
Yeah, if some of your viewers think that there might be one of those people that might be gluten intolerant, or they can't eat pasta, let's just say wheat pasta, go to the grocery store and find pasta that says made in Italy. Then try to eat that and compare that to something that was made in the United States. And I could almost guarantee you that they'll see a big difference in how they feel. Because everybody's different. You might get a headache if you eat a particular food. I get a stomach ache. The next person gets a rash. It doesn't matter what the outward sign is. What matters is that all are caused by your body being inflamed.
And so lots of people might not even realize that they're actually having like an allergic reaction to something.
Yes, true. I just had a discussion with a patient this morning. They get very phlegmy when they eat dairy, or they get another patient would get a lot of congestion when they drink a beer, or have something like that. That's a sign of inflammation. That's when your body starts creating a lot of mucus. That's a sign you better start looking at maybe what you just ate. It could be a problem.
Okay, so tell me some options, because I was reading about this, that you do have some options for our cancer patients. And what would some of those options be?
Yeah, we do treat cancer patients. We treat the patient, we don't treat the cancer. Okay, they get a lot of pain relief with what we do as they go through their treatments. Some of the stuff that we do nutritionally works together with their treatment, not against their treatment. We know that there's certain things that we can't recommend with patients going through chemo and radiation, as opposed to if somebody wasn't going through chemo and radiation. And that's something that you learn, in school and recommend accordingly. So.
Okay, because I had a great deal of success with the CBD, with CBD. Now, that's something that you offer here also, right?
Yeah, it is. CBD oil has, back in 2018, President Trump signed the Farm Bill, and it opened up CBD to be legal, and it's legal in Ohio if it has less than 0.3% THC. At our office, we carry a particular brand that's 100% organic, GMO-free, gluten-free. Everything is 100%. We get the hemp from Oregon, and it's grown on an organic farm. And people use it every day. They'll sometimes take typical dosage is 0.25 mils twice a day. Some people do 0.25 mils 3 times a day. There's different flavors. We also have a version that's THC free, and those and the people that usually buy those that particular product get tested for
yes, because lots of people at work get tested, and a lot of people are worried like they're going to come up positive.
Yeah. Now the THC free stuff that we give is by nature is a little bit less potent, because they actually take out some of the it's more broad spectrum than full spectrum, but it's still very effective. So.
Yeah, that's something that, because I don't usually do opioids at all, I stay away from them. But that has really helped me, and it's not something, and people have to remember, it's not something that you're going to take once and the pain's going to go away. Right. It's something that you have to keep using, and it builds upon itself. Yeah. And that's not going to mean that you're ever going to be pain free, but it's certainly much healthier than becoming addicted to an opioid.
True. Very true. Our bodies have an endocannabinoid system, just like we have all these other systems. And as long as you keep a steady stream of endocannabinoids, whether it be from CBD oil or from different vegetables, you'll have that effect with the receptors. If you don't take it, or if you stay away from it, those receptors sites are not occupied. You won't have the results.
Okay, and I also had some really good effectiveness with acupuncture.
Yes, acupuncture is great. That's been around for 5,000 years. It's very good for pain and addiction. We have an acupuncturist here that comes to the office once a week on Thursdays. And she gets a lot of good results with a lot of different people. So.
Yeah, because a lot of us, the chemo patients, we have a lot of arthritis that starts, we have a lot of inflammation that happens, and it really did calm it down for me. So
Yes.
It was very effective.
Yes,
for me.
absolutely. And the VA is also allowing chiropractic and acupuncture for their patients, and they refer them to us. Quite
That's
often.
wonderful.
So,
That's good to know. Now, women, you treat a lot of women here, and so you can treat women with fertility issues, menstrual disorders, pregnant women. Maybe go into a little bit of what you can do specifically for women.
Now, what we do, just to be clear, we treat the person, we treat the woman. Okay, so if they come in, so let's just say they're having an issue with fibroids, we'll clean up their diet, try to get them off a lot of junk food, because we know that your body, when it stores fat, it'll also store estrogen. We'll look at their entire past history. But there are a lot of times if they fail or they don't succeed with the diet part, obviously we have to make the proper referral to their family doctor or to their OBGYN. So
you take everyone's health very, very seriously. And if there was ever anything I came in with, you'd be like, no, I don't know, you got to go talk to your doctor first, and then maybe we can do something with that.
It's individually, it's totally individualized. You're as different as everybody else.
So, and along with the other things is headaches.
Yes.
Yeah, because that's usually caused with spinal issues of some
that's
sort.
one of the triggers. Headaches are there's a lot of different causes of headaches. Some are physical, some are emotional, some are chemical, or biochemical, I should say. We see a lot of people that with artificial sweeteners or with screen time in front of a computer, that creates a headache. If they use an artificial sweetener, sometimes that creates a headache. Pinched nerve in your neck and your upper back, those can all produce problems too. So.
Okay. What about because you see a lot of especially kids in that with ear infections. How can you help with someone with kids like they have ear infections?
Sure. If you go to Europe, a lot of times they don't prescribe antibiotics for ear infections. They just wait and see what happens, and they'll adjust the child. There's been a lot of studies with colic and ear infections where the adjustment or the manipulation of the spine will actually open up a particular fold in the neck, and it'll relax this muscular fold and allow the ear to drain. And that's been well documented for a long period of time. Same thing with colic for infants. When the infant cries uncontrollably, it could be something that they're eating or the formula that they're eating, or it could be something from in their middle back. Sometimes they roll off the bed. Could be something that is as simple as an adjustment can fix.
And that could even be something that happens during the birthing process.
Birth trauma, absolutely. If they have a birth trauma, you can definitely see that. And people always become unglued when you started talking about adjusting kids. I've been adjusting my kids since they were 15 minutes old. There's a certain way to do it. It's not the way I would adjust you or I would adjust the next person. It's very, very slight, light contacts, but it is effective for those two things.
Yeah, because I wanted people to know that you can start right when they're born.
Yeah.
You're not gonna. It's not if you
my
take them
kids
to
were
a qualified.
15 minutes old.
Yeah, you take them to a qualified chiropractor.
Absolutely.
Absolutely. So, what about treating pets?
Yeah, there is Dr. Duffy, who works here, who does our acupuncture on Thursdays. She is licensed, or I shouldn't say, she's certified as a vet, or not. I'm sorry. She's certified as a chiropractor for animals. So she does adjust horses and dogs, and it's usually under the license of a vet. And
because they have pain just like people.
They do, and they respond really well. So
now, when I was looking into this, I was looking at sports injuries, and I found out that half the NFL have a chiropractor on staff. So what can you do for the kids that are playing football and tennis and all of those sports? What specifically do you provide for them to help them?
Sure. Injury from sports is very normal, but it depends on how you treat it as far as how fast you can get better. What we do is obviously we take a history, do an exam, come up with a diagnosis, and we treat we treat the patient. We have different modalities to do that. One of them is through the adjustment. We have laser therapy. We have interferential ultrasound therapy. We have exercise therapy. People seem to get better faster, not only when you give them exercise, but when you give them an adjustment also. And you clean up their diet, you take them away from sugar, because remember, sugar causes inflammation. And when you sprain your ankle, what is that? That's inflammation. So you don't need to put gasoline on the fire. So we try to educate people on how they can take care of themselves even when they leave here. So.
Yeah, like my son had come in and he had a very deep tissue bruise.
Yes.
So what did you do for him to help that bruise ease?
Yeah, we do laser a lot of times on bruising like that. And what the laser light does is that it focuses a strong amount of photons, which are little pockets of energy, to help excite the cells and to help speed along the healing process. So it works out very well.
And so now when it comes to mental health, how can chiropractic help mental health?
Well, the whole idea of having somebody, actually physically touching another individual will help relax them. Well, the personalization that we give. They did a study years ago about who was satisfied with their chiropractor, and there was an overwhelming percent, like 90%, were satisfied with their chiropractor. And a lot of times when you feel better, you act better. Mm-hmm. So if you can take them out of a lot of their pain, you can switch around their diet. If they're eating a lot of sugar or a lot of processed foods, your stomach is your second brain. So if you heal the gut, there's a lot of times you can heal the brain too. So.
Mm-hmm. Now it can also help reduce blood pressure. Is that true?
Yeah, there is one particular adjustment that they've actually done studies on in the neck, where you did this particular adjustment, and it will help your blood pressure, along with a couple other things.
Okay, and how does it for improved sleep?
Sleeping is difficult because there's a lot of factors that involve insomnia. A lot of times when it's hard for you to get to sleep or to fall asleep, a lot of times it's an emotional thing that you're thinking of. A lot of times when you wake up out of a sound sleep, say at 2-3 o'clock in the morning, every single morning, could be a blood sugar issue, could be an adrenal stress issue. Those are all things that we can help you with. We do different tests, blood work, allergy testing through blood work that could help with that. There's just a lot of things that could sleep can also be from pain that you're having. Mm-hmm. So we can take you out of your physical pain and help you that way. So. Yeah,
so tell us a little bit more about, because my one son had that, where you kind of do like blood work on them, and it kind of, explain that a little better than I'm doing it right now.
Sure, absolutely. Through your blood work, you can find out if, let's just say, if your sugar is unstable. And if your sugar is unstable, it might bottom out in the middle of the night, and then your adrenals kick in and they raise your blood sugar and you wake up. And so some people will say, I wake up at 3 o'clock in the morning every single morning, 3:01, and that they can almost set their clock by it. So with those people, if they are having a blood sugar issue, we'll tell them to just eat a couple ounces of protein before they go to bed. A lot of times that'll normalize their blood sugar. They'll sleep through the night. It'll be no problem. Worst thing you can do is have some kind of sugar or refined carbohydrate right before you go to bed, because that'll raise your blood sugar and then drop it like a bad habit. And then there's other people that just need melatonin, or maybe just need to relax with a little bit of valerian root. Mm-hmm. Valerian root is a natural herb that helps relax your body. So
now, if they're in need of vitamins, do you actually sell the vitamins here?
Yeah, we have nutrition here. A lot of the nutrition that we have here, you can't find at another place. They only sell to doctors because it's all organic, and it's 100% natural. It's just hard to find that, in a retail store.
Yes, because a lot of vitamins, they're just expensive pee.
That's right. It's very unregulated. There's only 2 ways to absorb curcumin, as an example. Curcumin, turmeric is the hottest thing now, and I only know of 2 different ways to absorb it. I carry the one way through the one company here, and then there's another way. But the rest of it, it's because curcumin is so hard to digest. A lot of people just aren't getting the effects that they should, or they have to take so much of it, it irritates their stomach. It's just one example.
Yeah, because I had done an episode on scams for seniors, and when I was doing the research for that, like vitamins and minerals were like at the top of the list.
Yeah, because they're the wrong forms. Just like as another example, calcium carbonate. You can buy that stuff for $3-4 a bottle at the store, but calcium carbonate is only 40% absorbed. You know, plants eat rocks and then we eat plants, not the other way around. We don't eat rocks because you won't get a good absorption. So you're right, you're getting expensive urine at that point.
Okay, wonderful. There is one question I want to ask you. I do know someone, a child that was just diagnosed with Crohn's. And I know as a child it's it's a terrible thing to get because that whole lifestyle has to change dramatically.
Yeah, for sure.
So when you see a child come in with Crohn's, what are some of the things that you can maybe help them with or give advice to parents on?
Yeah, you know, the biggest thing is, you know, keeping them away from the processed foods and the sugars. You know, that's one of the biggest things. And when you deal with kids with foods, you don't want to take something away and not replace it with something. So, you know, and again, depending on every individual, sometimes fruits and vegetables bother people with Crohn's. So you got to watch that. But you just want to find different foods that are good for them that they will eat. And sometimes it just entails a lot of experimentation. And every kid's different. So, you know, you would want them to eat, you know, proteins and good fats and fruits and vegetables, but it might not be good for that particular person to eat those kinds of foods when they have Crohn's. So you have to go with what their body tolerates.
Yeah, and now more than ever, there's a selection now. You can actually find food for people that have the celiacs and the Crohn's.
Absolutely.
And
there's a whole section in your grocery store that's dedicated to people with celiacs. It's not like it was before. You know, when people say, I can't eat bread anymore, yeah, you can. You can eat bread. It just has to have coconut flour, tapioca flour, something other than wheat flour. So there's a ton. I can't eat pasta anymore. Yes, you can. There's all kinds of pastas out there that are gluten-free. It's so much healthier eating right now than it has been in the past because there's so many people that have issues.
Yeah, and the price on everything I've noticed has come down.
It has.
It's a little bit more expensive still, but it's pretty comparable, and most people would be able to.
You're absolutely right. Yeah, the big thing is that what you were eating before, there's probably, I'm 90% sure there's a substitute for. So it's not like you have to go without it. If you like your pasta, eat pasta, just not wheat pasta.
Right.
Or you know, some people are allergic to coconut. And they can't eat coconut flour pasta, you know, or tapioca, whatever, you know.
Yes, because I've even seen like coconut flour at like Big Lots.
Yeah. Rice flour is another big one, but some people are allergic to rice. I mean, it's all depends on what you have going on.
Okay. So. Well, I want to thank you today. You were extremely informative.
And thank you for having me.
Well, thank
My pleasure.
You. And if anybody wants to get in touch with DiSalvatore Chiropractic, they can call?
Yeah, they can call us or visit our website, DiSalvatoreChiropractic.com. Or our phone number is 440-992-0160.
Yeah. So the takeaway is you know, explore a little bit. Don't just stay in one lane. There's a whole lot of world out there to explore and know about. And the thing is to educate yourself and take care of your body.
Yeah, we only have one body, and if it's not working right, try to figure out what's wrong with it and then fix the problem. Don't cover it up.
Okay. All right. Well, thank you, everyone, and we will see you next week. And until then, good afternoon and good memories.